patient comes in with a herpes lesion in their mouth. Any updates on what to do?
Find out today on Medical History Mysteries.
My co-resident in my residency always said, herpes gets the last laugh. Here we are as dental professionals, and we see it all the time on patients, whether it's on their lips or inside their mouth. It can be incredibly painful and unsightly, and patients want it to go away as quickly as possible. What can we do for them?
Herpes, the gift that keeps on giving. Yes. So, what is it about herpes as a virus? Well, there's good and bad. The bad is that herpes as a virus tends to hide itself in places where it becomes very difficult to treat it because it's hiding. And so it's almost untreatable in that case, which is why we say once you have herpes, you have it forever. But you can take steps to make sure that the outbreak is from limited to none. And that usually involves taking an antiviral agent on a daily basis. If there's any good news about herpes simplex is that it's as I like to say, a very neat copier. Meaning when it makes copies of its DNA, it very rarely introduces any mutations. And so we can keep using the same drugs we've used to treat herpes over and over year after year because the copies are pretty, pretty clean. That you can't say the same for things like HIV and even COVID because they're sloppy copiers, right? Whenever the copy process takes place, they introduce changes, mutations, which then makes the medications we were using to treat those viruses ineffective. I'm going to change up new medications. So what have we used all these years historically for the treatment of herpes simplex? Well, Zovirax or acyclovir is still the mainstay for most folks. The one drug that has really changed the landscape somewhat is Valtrex, so valcyclovir. Because valcyclovir offers you that once daily dose you can take forever, basically, and reduce the risk of future outbreaks. I can't say it's guaranteed because lots of things can induce an outbreak, but I think it's probably the one way to keep the outbreaks at bay for a long enough period of time. And I've seen people who've used Valtrex who unfortunately run out, they don't get their prescription refilled, whatever, and they get an outbreak almost immediately. Again, as I'm sure everybody knows, if the patient has an active lesion, we prefer not to treat them, obviously, especially because you can transfer those lesions from extraoral to intraoral very easily, even with a local anesthetic injection. So, we don't want to go down that road. The last thing we want is to introduce herpes lesions inside the mouth because they can proliferate rapidly. And that makes the person's life much more miserable than if they just have, an external lesion. But remember that these drugs are also used to treat zoster infections, specifically shingles in adults. Controversially, in children, used to treat chickenpox, but used to treat shingles in adults. And so I wanted to make sure I mentioned that because if you're going over a medical history and somebody has, Zovirax listed as a medication they're currently taking, you can't assume anything because it could be herpes simplex or it could be, a zoster infection like shingles. But at the same time, realize these drugs also have some pretty nasty central nervous system effects. They cause insomnia, they cause irritability. So if you're taking a pill, one Valtrex every day, it can change your life literally forever. Okay, well then don't use it. But the problem is viruses like herpes simplex won't go away on their own. And every time you feel some kind of stress, or you get some type of infectious process, then you've got this outbreak, which makes you miserable. So, it's in my mind, it's treating it is better than not treating it in this situation, even if you have to deal with some of these central nervous system side effects.
What about people that self-treat with lysine?
Heard that often, and I think lysine does work. I don't know why, I don't know how. I wish we had more studies on it, but lysine seems to stabilize the mucosal membrane to prevent the outbreak. I'm not really sure how it works, But I say, if you're using it and it's working, keep doing it, even if we don't understand the process fully. And some people do take the lysine along with their Zovirax, and unless there's a specific interaction between the two, I say why not?
And if you're taking acyclovir or valcyclovir for an acute lesion, when do you take it? Do you tell them to take it when they get that tingly feeling or when they start seeing bumps show up?
Oh, very good question, because it really depends on the prescriber. Some prescribers say you get that first tingly feeling, start therapy immediately. And some say, well, let's see, because not every tingle becomes a lesion. And so I think most people I know who have herpes tend to err on the side of the first part. As soon as I feel that tingle, I'm going to start therapy. And that's why some people decide I'm just going to take a pill every day and never have to worry about it. The other controversy is the topicals don't seem to work as well as we'd like them to. Zovirax ointment, the 5% ointment, and the cream that they make are pretty good. I wouldn't say they're the most effective. For the longest time, we had Denavir, penciclovir, which was really effective, but really expensive as well. And then we have some of the over-the-counter like Abreva, which works pretty well, I would say. Again, if you're keeping up with it. But I think most people realize at this point the best thing to do is just take an oral agent and take it every day if you don't want to deal with the outbreaks, because ultimately an outbreak can occur at any time.
Yeah, and you can even use a laser if you have a laser in your practice to help try to reduce the time of the lesion. So
Exactly. Yep.
the sooner you can treat them, the better off they are. So there's other things we can do for them as dental professionals. But when they're in that state where the lesion is very vesicular and bubbly and oozy, you really don't want to be treating them for their dental procedures.
Correct. And the holiday season's coming up and you're going to be kissing a lot of relatives. So make sure you look first before you give them a quick kiss on the cheek, because again, you might take home an unwanted friend with you. So it can happen that easily.
Most definitely can. Well, thanks for these tips and these reminders. And I think we'll feel more prepared next time we see a patient that presents with a cold sore, herpes, whatever you want to call it, on their lip or in their mouth.
Sounds good.
All right, everybody. For Medical History Mysteries, we will see you all next week.
Thanks, everybody.
Bye.